All right, thank you for joining us today on New to Medicare Medical Review. My name's Mary Sue Gardner, and I'm a registered nurse on the Provider Outreach and Education team, and I'm going to be your facilitator for today's event. I'm also joined today by other members of Provider Outreach and Education, as well as Medical Review, who will assist me in the question and answer portion of today's call if that happens to be necessary. A few housekeeping items before we get started. As I mentioned briefly on the last slide, our website, WPSGHA.com, we have a training center link at the top of that page. In our training center, you're going to find all things education, such as the training material, like the slide deck for today's event, any upcoming educational events, and the ability to register for them, access to our encore presentations that you can watch outside of YouTube as well. Those encore presentations, again, are generally on our encore page for about 60 to 90 days, but they're always available on our YouTube page until the information is either changed or updated. If you have questions during today's event, you can place those questions into the chat and send it to all panelists. And that way, my associates that are working with me on today's call can help answer those, or they'll ask me during the question and answer portion of today's call. Finally, if you're listening to this as an encore, we also encourage you to take our survey, whether you're listening live or as an encore, actually. We encourage you to take the survey. Live event, Jennifer placed the copy of the survey into the chat. So if you find you happen to need to leave this event early, go ahead and copy and paste that survey link into your web browser. If you're listening as an encore, the survey link will be available in several different manners. There should be an eye in the top right-hand corner of your screen, and it's also in the description of the event as well. With all of our presentations, we have to give you a disclaimer, and this disclaimer basically says we prepared this information as a tool to assist our provider community, but know that the Medicare rules often change. So today's presentation was based on the laws, rules, and regulations as they stand today. But as a Medicare provider, especially if you are new to Medicare, it's important that you know you should always go back to CMS for final determination on everything. And you should also make sure that you are following the most current laws, rules, and regulations as they stand on the date of service you are providing services to a Medicare beneficiary. All right. Acronyms. Medicare is full of acronyms. So if you are new to Medicare, you may not be familiar with some acronyms that I will probably say during the course of this call. If I happen to use an acronym you're not familiar with, please just refer back to this list. If I say something that's not on this list or defined in the slide deck, you can just simply put that into the chat and Jennifer will answer that for you. My objective for today is that you, as a new Medicare provider, learn about the medical review programs and their purposes under the Medicare program. We're going to accomplish this today by reviewing the purpose of medical review as a whole. We're going to discuss who conducts medical review. We're going to review why claims are chosen for medical review. And finally, we're going to highlight where you can find more information on the requirements. So let's start with medical review and education. What's the purpose of it? Why do we do it? The overall purpose or the goal of all medical review programs and contractors is to prevent improper payments from being made and protect the Medicare Trust Fund from those improper payments. And this is done by identifying errors through things like claim analysis and medical record review. As contractors, we can use any relevant information that's deemed necessary to help us make claim determinations. So let's move on and talk more about the medical review contractors and who they are. There are several contractors under Medicare that conduct fee-for-service reviews. They include the Comprehensive Error Rate Testing Contractor, or CERT, which I'll refer to all of these as their acronyms as we move on. So the CERT contractor, the Medicare Administrative Contractor, or MAC, which is what we are. We're your Medicare Administrative Contractor. There is the Supplemental Medical Review Contractor, or the SMRC. And finally, there is the Recovery Audit Contractor. And there's a few other contractors that we will talk about as well. And just to pause for a second, Jennifer, I see that someone by the name of Kelly is having issues with hearing. Could you please send Kelly the dial-in information? Thank you. Anyway, so we're going to discuss these contractors again more in depth later in the presentation. Sources of information for medical review. So where do we get the information on what we're going to do? And where do other contractors get their information? And the primary source is data analysis. As a MAC, we have a data analysis team that basically examines the data on what we are paying out at high rates, high volumes, et cetera. So they're looking at what's coming through our Medicare paying and processing system, and they're looking for vulnerability. And they take that information and they drill it down as far as they can to who are the providers that are posing the highest vulnerability in those categories that they identify. And then they drill it down as much as they can again, and if we can't make head nor tails of it, we may choose those providers that pose the biggest risk to that specific service that we identified, and we may pull them for a targeted probe and educate review. So to kind of say this in a different way, we're looking at what services we're paying and processing as a MAC, those services that pose the highest risk to the Medicare Trust Fund. Once that's identified, who are the providers under that category that pose the highest risk, providers or suppliers. And then those then may be the ones that we choose to do an actual medical review on those. Now note that data can come from a variety of different sources. So for instance, we can get referrals from other medical review contractors. We can give referrals to other medical review contractors. We also watch data from other medical review contractors and their findings. And if they're having a lot of findings, we can also run data on our end to see if that affects a lot of our providers as well. And that's something that typically occurs with the CERT contractor or the OIG contractor, the Office of Inspector General. So we watch this stuff. If they're having findings, we look at our data and see if we're having findings as well. And we'll discuss again CERT and how they get that information in a few minutes. So let's talk about the Center for Program Integrity and their oversight. All right, so the Center for Program Integrity, their mission is to prevent fraud, waste, and abuse in the Medicare and Medicaid programs, as well as in federally facilitated marketplace programs. So CMS's Center for Program Integrity, They actually oversee Medicare medical review contractors. The Center for Program Integrity conducts contractor oversight activities such as like broad direction for medical review, reviewing and approving Medicare contractors' annual Medicare review strategies. They're the ones that are facilitating the Medicare contractors' implementation of recent enacted Medicare legislation, and they're responsible for facilitating compliance with current regulations. As we continue with their oversight, they also ensure Medicare contractors' performance of CMS's operating instructions. So they make sure that the contractors are following those guidelines. They also do monitoring and evaluation of the Medicare contractors' performance. So how we're doing in accordance with CMS program instructions. And finally, providing ongoing feedback and consultation to contractors regarding the Medicare program and the medical review issues. And that's important to know where that oversight comes from. We don't just get to go out there and do claim reviews willy-nilly. We do have program oversights and safeguards that are in place for all contractors to follow. So I told you a little bit ago, we're going to talk about these contractors specifically. The Center for Medicare and Medicaid Services really strives in every case to pay the right amount to legitimate providers. And we want to pay the right amount for covered services and services that are correctly coded, correctly billed, provided to beneficiaries that are actually eligible for the Medicare services. To achieve the overall goal of improving provider compliance and lowering error rates, CMS follows 3 parallel strategies. Those are preventing improper payments through the MAC and SMRC evaluations of the program and the program vulnerabilities. They want to correct any past improper payments, and that generally happens through post-payment claim reviews by someone like the recovery auditor, and measure improper payments and pinpoint the cause of those improper payments. And they do that by calculating service-specific and provider-type error rates, especially through the CERT contractor. So let's discuss those contractors a little more. And I just mentioned CERT. That's the first one up on our list. The CERT contractor, or Comprehensive Error Rate Testing Contractor, they are the contractor that measures improper payment rates in the fee-for-service program. Now, they do this by reviewing our providers' claims. So claims that we as your MAC paid and processed, and they want to make sure that we paid and processed them correctly. They choose a statistically valid stratified random sample, so a sample of claims from all fee-for-service contractors to determine if we're all doing it correctly. So the error rate that is assessed is the error rate on the contractor. So if they review your claim and determine that we didn't pay or process it correctly, that's an error rate against us. We don't want error rate. So we do everything we can to avoid or help our providers avoid getting those errors. Kind of in a nutshell, they're looking for payments that should not have been made or payments that were made for incorrect amounts. Both overpayments and underpayments are considered improper payments. So it includes things like payments to an ineligible recipient, payments for ineligible services, duplicative payments, payments for services that the beneficiary didn't receive, or even for incorrect amounts. And then I said stratified random samples. Those are chosen by claim type. So they're looking at Part A or hospital inpatient claims. They're looking at Part A claims that exclude hospitals, so that could be like a skilled nursing facility. They look at Part B claims, and they even look at the durable medical equipment, prosthesis, orthotics, and suppliers, or DEMIPOs, we refer to them as. So the error rate, again, is then assessed on the contractor. And I said, we don't want errors, just like you don't want errors. So it's important that when you see us doing any type of education that is CERT related, you as a provider pay attention to that. What we're trying to do is help you avoid potential review denials that may be coming your way. And I said earlier, sometimes our reviews are based off of what other contractors are finding. So if the CERT contractor is seeing a lot of errors in a specific type of service, we may then run data analysis and start our own reviews on that same type of service. All right, moving on. Your next review contractor is us. It's your MAC. Medicare Administrative Contractor is what MAC stands for. So a MAC is a private health care insurer that has been awarded a geographical area to process Medicare Part A, Medicare Part B, DME, all of those under the fee-for-service program. And it even includes home health and hospice. So CMS relies on a network of MACs to serve as a primary operational contact between the fee-for-service program and you, the healthcare provider that's enrolled in the program. So MACs cover a multi-state region or jurisdiction, as you will. We're responsible then as an AB MAC for administering both Medicare Part A and Medicare Part B services. All your claims processing, payment, your enrollment, everything. We at WPS, as your MAC, we were awarded the jurisdictional areas of J5, which includes Nebraska, Iowa, Kansas, Missouri, as well as J8, which is Indiana and Michigan. We also still have a national contract under J5, which covers Part A providers only in most states across the United States. We, as an AB MAC contractor, we do not process home health and hospice or DME. There's other states that cover in this region. So as a MAC, we are the primary operational contact, again, between the fee-for-service program and you, the provider. So some of the things that we do, we process your fee-for-service claims. We make an account for Medicare payments. We enroll providers into the Medicare program. We also handle provider reimbursement services for auditing and institutional provider cost reports. We handle redetermination requests, which are your first stage or your first level of appeal. We respond to provider inquiries. We educate. That's what you're here getting today. We educate providers on the fee-for-service program and billing requirements, as well as clinical issues when we can. We can write and do have local coverage determinations, which are policies that are specific to a specific service. And we write the coverage guidelines for those for you, as well as billing guidelines. We review medical records for selected claims, and we also coordinate with CMS and other fee-for-service contractors. So as we move on, the next contractor I want to discuss is the SMRC. So CMS contracts with a supplemental medical review contractor, or better known as SMRC, to help lower improper payment rates and protect the Medicare Trust Fund. So you see the similarities between all of us. You know, we want to lower those improper payments. We want to protect the trust fund. It's our overall goal of the medical review program. So the SMRC, they conduct nationwide medical review for Medicaid, Medicare A and B, DME, and they look at claims to determine whether the claims, again, are following coverage, coding, payment, and billing requirements. Now, the focus of the medical review may include things like vulnerabilities that were identified by CMS data analysis, the Comprehensive Error Rate Testing Program, or CERT program, their vulnerabilities that were identified. If there is information from professional organizations or federal oversight agencies that needs additional looking into, the SMRC may be assigned to do that. So at the request of CMS, SMRCs may also carry out other special projects to protect the Medicare Trust Fund. I like to think of them as the special project contractor. So their information is information that was given to them, and they're told by CMS to run the data and look at the information. The SMRC contractor is actually Noridian Healthcare Solutions. And if they needed to look at your claims, they would send a request to the provider or supplier for additional documentation on the claims for medical review. And that's the same as any review contractor is going to do. We're always going to notify you and send some sort of notification to you that we need to look at specific claims. And again, they're going to focus on those vulnerabilities, especially through those special projects that they are given. Next is the RAC, or Recovery Audit Contractor. So again, or their mission is to identify and correct Medicare improper payments through a collection. They're looking for overpayments made on claims for services to Medicare beneficiaries. And they're trying to identify overpayments and underpayments to providers so that if CMS needs to, they can implement actions that are going to prevent further improper payments. The easiest way to think of the recovery audit contractor is they are a collection agency. So they're the ones going out looking for bad debt and then trying to recoup that bad debt for the Medicare program. The RACs conduct both complex and automated post-payment reviews. So automated reviews occur basically through the system. And complex reviews, those required, a qualified individual to review the medical record in order to make that decision. The RACs work a little bit different than other review contractors in the fact that they are paid based on the money they recoup. So they go after the highest vulnerabilities because they don't get paid if they don't recoup money. If they found, or if it is found that they recoup something incorrectly, they also have to pay that back to the program. So again, just like someone that didn't pay their credit card bill and it goes to collections, that's kind of the same way the RAC operates for CMS. They are looking then at finding that bad debt and going out and recovering it. If the RAC, again, finds issues in a certain service, that may trigger any other review entity to possibly do additional reviews on that type of service, especially us as your MAC. And then I want to spend just a little time talking about additional medical review that can be done by the UPIC. So the UPIC is the Unified Program Integrity Contractor, and their job is to perform fraud, waste, and abuse detection and implement deterrence and prevention activities for Medicare and Medicaid claims processed in the United States. So specifically, the UPICs perform integrity-related activities associated with Medicare Part A, Part B, DME, home health and hospice, and Medicaid. And so the UPIC contractors actually operate in 5 separate geographical jurisdictions in the United States, and they combine and integrate functions that were previously performed by entities that were called the Zone Program Integrity Contractor, or ZPIC, the Program Safeguard Contractor, or PSC, and the Medicaid Integrity Contractors, or MIC. So one thing that can happen when we as your MAC or any other review entity is doing reviews of claims for a specific provider or facility, if we see things that could potentially be construed as fraud, waste, or abuse, we have a right and we have a direction that we need to report that to the proper people to investigate. So we then could make a referral to the UPIC, give them the information that we based our suspected fraud, waste, and abuse on, and they will make the determination if further review needs to happen on their part to look for fraud, waste, and abuse. And if they find it, then it would go to entities like law enforcement, et cetera, to serve those penalties. All right. Now, the last thing I want to really show you on the medical review contractor is the Review Contractor Directory Interactive Map. So if you downloaded a copy of the presentation, this is linked to take you out there. I'm going to go ahead and open this link. I'm going to pull it into view for you. And you can see I'm on cms.gov site. You can find this just by doing a review for Review Contractor Directory. You can type in something like interactive map and it will get you there. I just happen to link you straight to it. Now, say if you leave one of our contracts of work, so you leave Nebraska, Iowa, Kansas, Missouri, Indiana, or Michigan, and you go to practice somewhere else. Like, let's say you move to California, where it's sunny and bright. So you need to know who your contractors are in the state of California. Then we have taken you there, and you can find who the MAC is, who the UPIC is, who your DME is, and all of that information is broken down for you in this interactive map. And as you scroll down, you know, you can see that it takes you to other areas, and depending, again, on how you filtered, it'll give you more information about other contractors in your area. So I like to show people this because you may not always continue doing the same thing in the state that you're in right now. You may want to move out of the Midwest to somewhere sunny and warm. You may move to the East Coast. If you continue your same job, the first thing you need to know is who's paying and processing our claims. Who is my Medicare contractors, and who do I bill to? There are some Medicare contractors that pay and process DME, home health hospice, as well as ABMAC. So you need to know whether you fall into one of those areas if you happen to move out of us as your Medicare contractor. So that's just a little nicety to have in your back pocket. And let's talk about the types of reviews and reasons why we do those. So there are 5 different types of reviews listed here on the screen. Prepayment, there's post-payment or retrospective, there's targeted probe and educate or TPE, there's a prior auth or PA, and then there are automated reviews as well. Prepay claim review just means that the review is done after you submit the claim in the Medicare billing world, but before you receive any payment. So that claim is halted from going to the payment floor. You are issued an ADR request, and we ask that you send the documentation in, and we make a claim review determination before any money is exchanged. Post-payment or retroactive means what it says too. This happens after we've already paid you. So after we paid you, then one of the review entities is going to request your documentation to make sure you got paid accurately. Targeted probe and educate mainly happens on a post-payment basis, but could be on a prepayment basis. And this means we're targeting a specific service that you are billing. You will know if you're under a targeted medical review with us or a targeted probe and educate process, because we will contact you. We're going to establish a point of contact. We're going to let you know what service we're looking at. We're going to tell you what type of documentation we're going to be requesting, and we're going to make you aware before that program starts. And then as things are billed, we could hold those prepayment or postpayment, generally prepayment during the targeted probe and educate process. I might have said postpayment on accident a second ago, but generally it's prepayment under the targeted probe and educate. Next is the prior authorization. So there's 2 different prior authorization programs under Medicare Part A and Part B right now. The first is the hospital outpatient department prior authorization process. And this is for specific services provided in a hospital outpatient department of a PPS hospital. They include things like Botox, peniculectomies, vein ablation, etc. CMS actually has defined 8 specific services that fall under this program when they are performed in the outpatient department of a PPS hospital. So we review prior authorization requests for these services. The decision then is not to pay or deny, but the decision instead is that we give a provisional affirmation that if all the documentation provided before the service was performed supports that it is definitely medically necessary for this patient to have this service, we can tell you provisionally to go ahead for that facility to perform and bill that service to Medicare. And we will provisionally pay so long as it's billed correctly, nothing changed from when you asked approval for it, etc. The second program under the prior authorization is the RASNAT program, or Repetitive Scheduled Non-Emergent Ambulance Transports. So this is another prior authorization process. Again, provisional affirmation is given for you to do Part B ambulance. This is specific for Part B ambulance suppliers that are going to be doing repetitive scheduled non-emergent ambulance transports for a beneficiary. And that is, there's defined parameters in that as well. So for it to be considered a RASNAT type transport, there needs to be 6 or more one-way trips that are going to happen during a 10-day period. Again, documentation is submitted in advance to support why medical necessity is supported for this patient to have to go to these transports via ambulance. And then finally, automated reviews. Automated reviews are the edits that are set up in the billing system to automatically capture things if billing doesn't line up like it's supposed to. So the overall reason we do all of this, again, is to protect the Medicare Trust Fund. We as a MAC, we couldn't possibly make a dent in reviewing all of the claims that we pay and process on any given day because it's thousands and hundreds of thousands. And that's why there's several different types of review entities under CMS to really help identify those vulnerabilities and protect the Medicare Trust Fund. Contractors choose to do review when their data has been drilled down so much that now we need to take a look and see if it supports the coverage criteria. And again, we do this because the data indicates there's vulnerabilities or another contractor received a referral, maybe from another review entity even, or there's new initiatives that are put in place and a contractor may need to monitor for a period of time to make sure that claims are being paid and processed correctly under that new initiative or that new covered service under Medicare. So that was a lot of information. Let's kind of recap what we did today. Today we went over those medical review programs, to help you, our providers that are new to the Medicare program, understand who could potentially, come knocking on your door. Medicare, we want to look at your reviews, or we want to look at your claims or documentation. We accomplished this today by going through the purpose of medical review and really discussing who these contractors are and what they do. We reviewed why certain claims are chosen for medical review and some additional information that will help you find who your contractor is. All right. Here is some additional resources that I always encourage you to go out and review. Most of these are going to take you to CMS's website. It's going to give you additional information on these, all the different contractors. So at this time, we have time for questions and answers. And I am looking over into the chat, and I do not see any questions or answers that have come into the chat at this time. So in the interest of time, I'm going to proceed on with the closing remarks, but if you have a question, I will pause again right when we get to the end and make sure we answer any questions that you do put in the chat. After the webinar is complete, those of you who logged into the webinar via the computer are going to receive an email. You're not going to receive this email if you only called in via phone. This email also is your proof of attendance, and it has contact hours in it if you need that for continuing education. So don't delete that without reading it. This email is also another opportunity to take the survey. If you are not able to take it by using the link Jennifer gives or the redirect that will be done at the end of when we close the presentation. All right. Follow-up questions. If you think of any questions regarding this event or the review contractors or their purpose, please email those to us. The email address is listed listed on the slide as well. It's wps.gha.education@ WPSIC.com. And just make sure you put in the subject line, new to Medicare, medical review. And then whoever's watching the mailbox on that particular day will make sure that gets to me. Please do this within the next 7 business days. If you have something that is claim specific, those need to go to customer service. So if your if your billing needs to be looked up, that really has to go back to customer service. We in provider outreach don't have access to that, and we definitely don't want you sending any kind of protected health information or personally identifiable information for you or a beneficiary through the internet. As I stated at the start of this presentation, we really value your opinion and we want to hear from you on how we did on this event. So we're giving you the opportunity to take the survey. We highly encourage you to please take the survey. We know you all have survey fatigue, but it only takes a few minutes, and it's also your opportunity to let us know what you need in the future. So not only gauge the effectiveness of the education today, but give us insight to what else you need. We take those suggestions very seriously, and most of our education is developed based on the things that you want. We want to bring you the information that you need to make sure you're doing your job appropriately. When this webinar closes, you're also going to automatically be redirected, and a page will pop up. It'll have this little yellow triangle. It's just WebEx's way of saying, hey, we're going to take you to a different website. It's going to take you directly to the survey if you click on it and hit continue. That's the easiest way to go ahead and take our survey. And I'm going to go back because I see a question did come in. This may not be the correct webinar, but wondering if it's appropriate to rebill a claim that has been medically reviewed with an approval or a denial. And the answer to that, there's a follow-up. Example, prepay ADR resulted in a partial claim denial after our review was found a coding error. Does this need to be sent through an appeal, or can the claim be rebilled? No, once a review entity has picked up your claim, you should not alter it in the Medicare system. You do need to go through your first level of appeal, a redetermination, and let them know that, you know, you had a billing error, what the correct billing should have been, et cetera. Supply all of your documentation to support your appeal and go through the appeals process. Remember, first level appeal, you have 120 days from the date that denial was assessed on your claim to submit that first level appeal. So don't hold off on those. Get your appeals going right away if you have something that was denied and you feel it was medically reasonable and necessary, and you can provide more information to support that. And you're very welcome, Kelly. Thank you for your question. Not seeing any other questions. On behalf of myself and Jennifer, as well as Medical Review, we want to thank you for your participation in today's event. This concludes our webinar, and you may now disconnect.